Hi friends, good evening. I'm Dr. Ashutosh Gupta and I'm a consultant in fetal medicine. So today we are going to talk about some congenital abnormalities to the baby, right? So as you are aware that every fetus has got some risks involved, right? Meaning thereby that there is 3 to 4% risk for a major congenital abnormality. 4 to 5% is the risk that probably we can have some minor variations to the different organs involved, and 1 to 2% could be the risk that probably the fetus could have a subnormal mental IQ, right? So meaning thereby that in total 10 to 11% is the risk that every pregnancy has to pass on. So this is general, just the general background risk. So every pregnancy has to pass, every fetus has to pass through this background risk of 10 to 11%. So now we're going to talk about a normal variation, right? So this is a fetus that we saw at 17 weeks and we identified something in one of the kidneys, and then we identified to be a normal variant. So probably I'm just making you see the videos and then probably we'll talk about. So this is the genetic sonogram at 17 weeks. So we identify the left renal upper pole, and then we identify the cyst. Okay, and then we can identify that the this left kidney downwards is absolutely good. So this is the left kidney, and then we cross over the spine and then identify the right kidney and the right adrenal gland. So that can be delineated, and the left renal cyst is being shown once again, right? So this is a normal variant that probably we are identifying. Renal cortical cysts, for traditional purposes, we have identified them to be acquired. That over the period of time, they can we can have it. So meaning thereby that 40 years, what we can have is this, that 2 to 3 renal cortical cysts, they could be normal variant. Now what we are talking about is a congenital cortical renal cyst. So they have also been identified to be normal variant. In most of the cases, they usually resolve, and but a follow-up is being required so as to see that it is not a part, because then we are able to see both the major chunk of the left kidney and then the right kidney in toto absolutely normal. So this is not a part of an MCKD, which is called as a multicystic kidney disease or a polycystic kidney disease, right? So this is not the part of that sort of an MCKD or a ADPKD, and we have identified it to be normal variant, and no sort of an. So probably we usually keep the babies under follow up, which routinely we do it. So this is a normal variant. We need to get worried about the whole scenario, and this is not a part of the MCKD or ADPKD, right? So pediatric nephrologist after the baby is born and those consultations and high risk, it is not required. So this is a normal variant, right? And shall resolve on its own. So probably we'll try to keep the baby under follow. Thank you very much for your patient listening.